You're listening to Vet Synapse, a podcast connecting the world of research, innovation, and practical help to the veterinary profession. I'm your host, Dr. Philip Judge from Vet Education. Let's get connected with Vet Synapse. Hi everyone, it's Philip here from Vet Education. I just wanted to jump online today because I came across a really nice case series. It was a retrospective report of clinical improvement in symptoms of hepatic encephalopathy in two puppies that were treated with intravenous lipid emulsion therapy. So this is kind of interesting. It's not really been documented all that well before. In 2021, there was a single case report of a dog with neurological signs that was diagnosed with a portosystemic shunt that was treated for intravenous lipid emulsion therapy and supportive care. And in that patient, neurological signs improved and interestingly, ammonia levels fell as well in that particular patient. They actually gave this dog in 2021 intravenous lipid emulsion therapy for suspected toxicity, and subsequently found that this patient had a portosystemic shunt. So that was prior to this case series of the other two cases that I'm going to talk about in a second. This was the only reported case of a clinical improvement in hepatic encephalopathy following intravenous lipid emulsion therapy. So this case series involved two dogs. One was a 14-week-old Chihuahua that presented with lethargy and ataxia and vomiting that progressed over the preceding 2 weeks. The dog was found amongst all of his other blood tests to have elevated ammonia levels. He had lactulose enema on presentation to the initial clinician who saw him. He actually had midazolam to help control his neurological signs, but became quite dull with that. He was still dull several hours afterwards when he got referred to the treatment hospital and was given flumazenol as an benzodiazepine reversal agent, but he was still quite dull several hours after that. So he had a dose of intravenous lipid emulsion therapy 24 hours after his initial presentation to his referring vet. Now, interestingly, immediately after his intravenous lipid emulsion therapy, there was a notable improvement in his mentation. The dog, prior to treatment, had nystagmus and a head tilt, and both of those things went away, and he was eating 5 hours after his intravenous lipid emulsion therapy. His owners declined any further diagnostics, and the dog went home just with standard medical treatment. But that was an interesting case. The second case in this series was a 14-week-old Newfoundland who presented with nausea and restlessness and dull mentation, progressing to stupor with an absent menace and a reduced gag response. And he also had an elevated ammonia level and was found on ultrasound to have an intrahepatic portosystemic shunt. He had conventional therapy with enema, lactulose retention enema, gastrointestinal support, and so on, as well as antibiotic therapy. 5 hours after admission, he wasn't looking all that good. He hadn't improved that much. So he had doses of intravenous lipid emulsion therapy, and 1 hour after that intravenous lipid emulsion therapy, his ammonia, which was about 2.5 times normal prior to therapy, was within the normal range. The dog was alert and responsive and began eating about an hour later. He was suffering from a little bit of anxiety about 6 or 7 hours after his intravenous lipid emulsion therapy, presumably because he's more neurologically alert, and was actually given some trazodone at that time. And he suffered profound sedation following that trazodone. It took quite some time to wear off. I'm going to talk about that in a second. But this case series, these two dogs, really point to the possibility that intravenous lipid emulsion therapy might be quite helpful in the management of hepatic encephalopathy, especially in those severely affected cases that are not responding to conventional therapy with lactulose and antibiotic therapy, supportive therapy to reduce GI bleeding, and so on. Just note that intravenous lipid emulsion therapy might reduce potentially the effectiveness of drugs that are lipophilic that we're giving these patients. And among those would be amoxicillin. It's quite lipophilic. Metronidazole, somewhat less lipophilic, but still might be affected a little bit. Propofol, that's been used as a continuous infusion to control seizures or neurological symptoms, and that might be affected by the administration of intravenous lipid emulsion therapy. So you might find that more of your propofol, because it's a highly lipophilic drug, gets bound by the lipid emulsion therapy. Interestingly, if you're using levetiracetam as an anti-epileptic medication, that's quite hydrophilic. Okay, so it's less likely to be affected perhaps than propofol. So a couple of interesting cases. Now, I did say I wanted to talk about trazodone because trazodone in itself is metabolized quite extensively in the liver, and it could potentially produce quite prolonged periods of quite marked sedation. So as a medication to kind of reduce anxiety in these patients may not be the optimal choice. So just exercise care when that has, if you're going to use that. So this is a really interesting paper came out of the Blue Pearl Vet Hospital in Tampa in Florida in the USA. It's just come out in the latest edition of the Journal of Veterinary Emergency and Critical Care. Well done on the authors for writing this case series up. I think it's a really interesting finding, and one that just adds to that 2021 case that I mentioned right at the start of this little communication. So keep an eye on this space. I think we've got some interesting things to look forward to going ahead. Thanks everyone. Till next time, take care. If you'd like to hear more of this podcast, why not become a Vet Education member, where you'll not only get access to podcasts, but our entire webinar library, plus a huge journal library, special offers, discounts, and a whole lot more. Check out the website veteducation.com for more details.